Good morning students. Today we will be seeing the lobes of cerebral hemisphere. Okay, there are 4 lobes in each cerebral hemisphere: frontal lobe, parietal lobe, occipital lobe and temporal lobe. In order to know these, what demarcates these 4 lobes, we should know about a few sulci and gyri. I will show you the important sulci which help us to separate the cerebral hemisphere into lobes. Okay, first and foremost, look at this sulcus here. This sulcus is the lateral sulcus. See, on the superolateral surface, you have a sulcus, a deep sulcus, which is running anteroposteriorly. This sulcus is the lateral sulcus. Actually, this lateral sulcus begins from the inferior surface. See, this is the stem of the lateral sulcus. The lateral sulcus begins from the inferior surface as a stem. Then it will divide into 3 rami. The 3 rami are anterior, horizontal, anterior ascending and the posterior ramus. The posterior ramus is the longest of the 3. It is around 7.5 centimeters long. Okay, so this will be the posterior ramus of the lateral sulcus. Okay, so it's enough even if you say this as a lateral sulcus. So lateral sulcus is a spotter. So this sulcus is the lateral sulcus. Lateral sulcus begins on the inferior surface. So this will be the stem of the lateral sulcus. Then on reaching the superolateral surface, this lateral sulcus will divide into 3 rami. The 3 rami are anterior horizontal, anterior ascending and the posterior ramus. Okay. So we will place the probe here and say identify the probe sulcus. So you will write it as either the posterior ramus of lateral sulcus, or it's okay even if you write it as a lateral sulcus. And then we'll ask the contents. The contents of lateral sulcus are deep middle cerebral vein and middle cerebral artery. The 2 contents of lateral sulcus are middle cerebral artery and deep middle cerebral vein. So this is the lateral sulcus. The next important sulcus is the central sulcus. Out of these many sulci in the superolateral surface, how do I identify the central sulcus? 1. The central sulcus will cut the superomedial border around 1 centimeter behind the midpoint of the frontal pole and the occipital pole. So this sulcus will cut the superomedial border. Then what will happen? It descends downwards and forwards on the superolateral surface and it will stop just above the lateral sulcus. So central sulcus will cut the superomedial border and it runs downwards and forwards on the superolateral surface and ends just above the lateral sulcus. So that is the central sulcus. Central sulcus is also a spotter. Identify the probe sulcus. Then we'll ask what type of sulcus is it? Central sulcus is a limiting sulcus. Why is it limiting? Because it separates 2 functional areas. Anterior to the central sulcus, we have the motor area of the cerebral cortex, and posterior to the central sulcus, we have the sensory area of cerebral cortex. So primary motor area and primary sensory cortex are separated by the central sulcus. So central sulcus is called as limiting sulcus. Okay, so this is the central sulcus. So now you know the lateral sulcus and the central sulcus. The third sulcus which I want you to know is on the medial surface. See, on the posterior part of the medial surface, another sulcus which runs anteroposteriorly. This sulcus is called as Calearine sulcus. Calearine sulcus. Okay, Calearine sulcus. On either side of the Calearine sulcus, you have the primary visual cortex. Okay, so this will be the Calearine sulcus. Why you should know this Calearine sulcus? From the Calearine sulcus, see where there is another sulcus here which ascends up on the medial surface. Yes, this sulcus is called as the parieto-occipital sulcus. So to pick out this parieto-occipital sulcus, first you should know the Calearine sulcus. See the Calearine sulcus, trace it, then pick up the parieto-occipital sulcus. Trace the parieto-occipital sulcus upwards. See, this parieto-occipital sulcus will just cut the superomedial border and end in the upper part of the superolateral surface. So this is the parieto-occipital sulcus. Okay. Then one more point which you should know here. Look at this border. This border is the infrolateral border. If I trace my fingers from the occipital pole anteriorly on the infralateral border. See, there is one place where there will be a depression. Okay, there is a notch. This notch is called as the pre-occipital notch. Okay, pre-occipital notch. Okay, now I will recap the structures which I have shown to you. Then I will divide the cerebral hemisphere into lobes. Okay, the first structure which we saw is the lateral sulcus. So this is a stem of the lateral sulcus. Lateral sulcus divided into 3 rami: anterior, horizontal, anterior ascending, and the posterior ramus. So this will be the lateral sulcus. Then we had the central sulcus, which cut the superomedial border, then descended downwards and forwards on the superlateral surface to end just above the lateral sulcus. Then on the medial surface, posteriorly, we saw the Calearine sulcus. When we traced the Calearine sulcus, we came to another sulcus, which is the parieto-occipital sulcus. We traced that up to the superolateral surface, only in the upper part of the superolateral surface. Then we saw a notch here on the infralateral border. That notch is the pre-occipital notch. Now, how are we going to divide this into lobes? Now, this part of cerebral hemisphere anterior to the central sulcus is the frontal lobe. Okay, the part of the cerebral hemisphere anterior to the central sulcus is the frontal lobe. Now I will draw an imaginary line from the parieto-occipital sulcus to the pre-occipital notch. I will connect the two. Okay, I will connect the pre-occipital notch and the parieto-occipital sulcus. I am going to draw an imaginary line. Okay, there is an imaginary line. Now from the posterior end of this posterior ramus of lateral sulcus, I will draw another imaginary line to meet the first imaginary line. Okay, so I have drawn an imaginary line from the parieto-occipital sulcus to the pre-occipital notch like this, and then I join with, I run another imaginary line to come from the posterior end of the posterior ramus of lateral sulcus to join this imaginary line. Okay, so it's going to look like this. Okay, now are you able to appreciate this? Okay, now this lobe will be the temporal lobe. Okay, and above this here you will have the parietal lobe. Behind the central sulcus and above the horizontal imaginary line you have the parietal lobe, and behind the imaginary line connecting the pre-occipital notch and the parieto-occipital sulcus you have the occipital lobe. So the 4 lobes have been defined. Frontal lobe is anterior to the central sulcus, so this is the central sulcus. Frontal lobe anterior to the central sulcus. Parietal lobe posterior to the central sulcus. The temporal lobe. Occipital lobe behind the imaginary line connecting the parieto-occipital sulcus and the pre-occipital notch. Okay, so this will be the occipital lobe. Then we draw another imaginary line to touch this first imaginary line. So below that will be the temporal lobe and above that will be the parietal lobes. Hope it is clear for you regarding how the lobes of cerebral hemisphere are separated. Thank you.